Medical Terminology JJ-T01-0137. Acute lymphocytic leukemia.
Acute lymphocytic leukemia. Albumin. Anisocytosis. Anticoagulant. Antiglobulin test. Apheresis. Aplastic anemia. Autologous transfusion. Bleeding time. Blood transfusion. Bone marrow biopsy. Bone marrow transplant. Chronic lymphocytic leukemia. Chronic myelogenous leukemia. Coagulation. Coagulation time. Complete blood count. Colony stimulating factor. Differentiation. Dyscrasia. Ecchymosis. Electrophoresis. Eosinophilia. Erythroblast. Erythrocyte sedimentation rate. Erythrocytopenia. Erythropoiesis. Fibrin. Fibrinogen. Globulin. Granulocyte.
Okay, now we're going to scramble the words, and then I'm going to read the meaning of each term, and then Nelly Stephanie is going to type it for you after 2 seconds that we give you for you to guess the answer. Okay, so let's start. Specialization, and it's a word that has 2 F's in it. Specialization.
Differentiation. Differentiation.
Out, juice, plural.
Ecchymosis.
Red, O, love of, condition.
Eosinophilia.
Now this is an acronym, okay? CLL.
Chronic lymphocytic leukemia.
This is the meaning of this term, medical term, and it is removal. It's a medical term that starts with AP.
Apheresis.
Not development pertaining to, and then in lowercase, anemia.
Aplastic anemia.
White compound.
Albumin.
Fiber O generation.
Fibrinogen.
Time for venous blood to clot. Time for venous blood to clot, and that this is a two-word phrase, medical phrase, and the first word starts with C and the second word starts with T. So time for venous blood to clot.
Coagulation time.
Okay. Let's put time in lowercase because you just have to type time, right?
Yes.
Okay. There you go. Okay. Bad amixing.
Dyscrasia.
Okay. See, now the double hyphen means that you actually have to write this when you're writing in real life. So C double hyphen SF, and it's an acronym too, right?
Colony stimulating factor.
Okay. Same ratio pertaining to and transfusion in lowercase.
Autologous transfusion.
Okay. Now it's another acronym. CML.
Chronic myelogenous leukemia.
Okay. Now we go to acute in lowercase, clear fluid, O, cell, pertaining to, and then leukemia in lowercase.
Acute lymphocytic leukemia.
Good. Fiber, chemical substance.
Fibrin.
Against, curdle, substance.
Anticoagulant.
Erythrocyte in lowercase, settling, action, and rate in lowercase.
Erythrocyte. Sedimentation rate.
Electricity O, carrying condition.
Electrophoresis.
Examination of core of bone marrow, and this is a medical phrase with three words. The first word starts with B, the second one with M, and the third one with B. Examination of core of bone marrow.
Bone marrow biopsy.
Red O, making.
Erythropoiesis.
Blood clotting, and this is the definition of a medical term. Blood clotting, and the term starts with CO.
Coagulation.
Okay, red O, germ.
Erythroblast.
Not equal, cell, abnormal condition.
Anisocytosis.
Donor to patient, bone marrow in lowercase, cells.
Bone marrow transplant.
8 minutes or less.
Bleeding time.
Globule, chemical substance.
Globulin.
Red O, cell O, poverty.
Erythrocytopenia.
There's another acronym, CVC.
Complete blood count.
Against, small globe, substance, test.
Antiglobulin test.
Grain O, cell.
granulocyte.
Taken from donor and infused to patient.
Blood transfusion.
Okay. Thank you very much for watching, and we're going to invite you to visit our website. Thank you.